Well, it's time to welcome our next guest on the program, and we're really pleased that she was able to take some time out of her busy schedule. So we have joining us today Margie Rodino, VP of Global HR with Sloan Global Holdings in Franklin Park, Illinois. Margie, good morning.
Good morning. Thank you so much for having me on the show.
Yeah, glad to have you here. So you're up in frozen chosen this morning, are you not?
Yes, for sure. Yes, it's the cold, barely sunny Chicago.
Yeah, I spent some time there, but I tell you, we down in Atlanta, you will laugh, but when it's 19 degrees down here, we think it's like minus 19 down here. We're not used to it anymore down here in Atlanta, Georgia. So we've got it pretty cold too.
Yes, absolutely.
Hey, Margie, give us a little background on Sloan and the demographics and size of your workforce, and then we'll kind of talk about engagement, health and wellness, healthcare consumerism.
Absolutely. Sloan is, for many of the individuals who might know, we are the leading manufacturer of commercial plumbing systems. We have been in operation since 1906, so we are over 100 years old. We're headquartered in Franklin Park, Illinois. We have been on the forefront of the green building movement. We have gone from flushometers to very sustainable restroom solutions. So our whole goal is to produce products that are water efficient, so that we can save one of our most precious resources, obviously water.
That's good. And your workforce is a combination of manufacturing employees as well as white collar office employees.
Yeah, we have a combination of, we have about 1,000 employees, and they are located throughout the United States, as well as a manufacturing facility, an assembly facility in Mexico. And our facilities include Franklin Park, which has our largest amount of employees, about 550 employees. And we have a plant here in Franklin Park, as well as office employees. And then we have a foundry in Augusta, Arkansas, that houses another 125 or so. And then we have another facility in West Newton, Massachusetts, and then in Detroit.
Oh, so you've got them across the country, different places across the country. Margie, talk to us about one of the key challenges in moving a workforce to healthcare consumerism is engagement, education, engagement, and communications. And talk to us about how do you offer medical benefits and engage employees in their health and well-being, and in turn, get them to do a better job with their medical spending?
Sure. I think there's multiple ways to do this, and I firmly believe organizations that are offering benefit plans owe it to their employees to help them understand not just what the plan is about and what it covers and what it doesn't cover, but to really educate them on basic interactions and basic things that they can be doing with their physicians or on a daily basis. So let me give you a couple examples. When we introduced our first high-deductible health plan for our employees at Sloan, we did an entire national rollout of the new plan. And what we did was we didn't just describe what the plan does, but we tried to help them understand the dynamic between what they're spending in contributions and what they spend at the doctor's office. So giving them an example of if you use a high-deductible health plan and you save in your health savings account, you can actually be saving tax money. Because as many people know, the money goes in tax-free in a health savings account. It stays in there. Interest is tax-free. And then when they utilize the money, it's tax-free. But what employees don't know is that's real hard dollars. When you put a screen up and you show that if that's $100, you're saving $25 in tax money because if you're in the 25% tax bracket. What we've attempted to do is explain those types of things down to very granular levels. Another example would be when you go into the doctor, many of the employees understand that their preventative screens are free, but what they don't do is when they call in, they don't call in to make the appointment and say, this is a wellness visit. So when they get to the doctor says, oh, it looks like you have a sniffle, and they diagnose them for a cold versus a wellness visit, and hence the doctor gets paid, $100, $200 for an office charge. What we're attempting to do is explaining to the employees, you might have a cold, but you set up the appointment as a wellness visit. It's your responsibility to enunciate that with the intake nurse and remind the doctor that this is a wellness visit and that's free. Yeah. So our goal, and I believe employers' goals, should be the same, is educate, educate, educate. There's so many different areas. Even with generics, employees are intimidated when they go into the doctor's office. Most of us kind of freeze up. Oh, the doctor said I should take this brand medicine. And they get reluctant to say, well, is there a generic for that? Which, as most of us know, the generics can be even a quarter of the cost of a brand item.
We've never had to ask those questions before, have we, Margie, as consumers? We've never had to think about that. We've always gone in and trusted our doctor. And it's not that you're not to trust your doctor, but it's okay as a consumer to ask questions and to be in control of your health and healthcare spend, and your preventive care. But we've never had to think about that.
I think you're absolutely right. I think when I do a lot of the employee engagement meetings around the healthcare myself because I'm very passionate about this topic. And one of the things that I've used as an example for the employees is I've said, you go to get auto insurance. And when you go to get the auto insurance, you pay a higher premium for a lower deductible. And you pay a lower premium for a higher deductible. So why aren't we doing all those things, shopping around when we're looking for our health care? Why is it that much more important for the car than it is for something that we use far more frequently? Because let's face it, our medical insurance is used way more often than our car insurance. Yeah. So we really need to be looking at that as much as we look at every dollar we spend in every shopping category that we have.
Are you, along the subject line in preventive, are you concerned about the measles epidemic with your population? Are you on doing communication, education around that? Is it an issue?
We are. It's a great question. We're always concerned with things like the measles, the mumps, the rubella, and the theory around whether or not you should be taking that vaccination or not taking that vaccination and all the hype related to that. If you think about the healthcare consumerism that we're talking about, we definitely are involving ourselves with where the measles have gone. It was basically eradicated in 2000. At least in the U.S., we had the measles eliminated, and that's information that we've taken from the CDC's Center for Immunization. When you look at that and you think now, the measles, the mumps, the rubella, all these preventative vaccines, and what the cost is, not just to the medical plans, but the cost to the employee in getting that and transmitting that to other individuals. That's a huge concern for us, specifically in a factory where our employees work elbow to elbow in our assembly line. They're right next to each other. So one of the things that we've done is we host weekly healthcare lunch and learns in our cafeteria. We have an on-site medical clinic that we put into place in 2014 in our Franklin Park facility. And that is one of our topics that we're going to cover is the whole idea of vaccinations and what that means not only to yourself and your family, but to the population in general.
Yeah. Margie, with your on-site clinic and the kind of services that you're providing and preventing, are you embracing any of the emerging telehealth solutions as part of your solution set?
Oh, this is such a great question for us. We have engaged the telehealth solution for our pediatric group. When
really?
we brought the on-site clinic in to Franklin Park, we have 3 shifts here. And so in order to manage the 3 shifts, as well as the employees on the factory floor really wanted to be able to do pediatrics through age 12. And what we found was it was very difficult to get physician assistants or nursing practitioners that had both adult care as well as pediatric and young adult care. And so the company that we have partnered with, in-house physicians who manages our clinic, actually brought to us a tele solution. And what happens is if an employee actually wants to have a child or someone seen in the up to 12 age category, they make an appointment, and usually they can even make a same-day appointment and still get the telehealth solution. They make the appointment, and then they can speak with the doctor, as you're suggesting, through the telehealth solution, either from home or from our facility. So we make it available if they want to make an appointment here and speak to the physician about their child, or do it from their home through Skype or through the phone. They have all of those options. We're just not yet sophisticated enough to have it as emergency or acute care.
Right. Are you going to eventually make it available for adult care to access for your population and their families themselves beyond just pediatrics?
We are going to consider it. What we're doing right now is we're evaluating our utilization, and so what we're doing is looking at what are the hours that we're getting the best utilization and where are the gaps. So we're anticipating about mid-year, when we have our 1-year anniversary, that we'll do some sort of survey with the employees to identify those gaps, and that is one of the areas that that's in consideration to fill those gaps.
That's very interesting. You're doing some very innovative things, and this time flies on this program, and I really enjoyed having you. Leave our audience, though, with some takeaways, 2 or 3 takeaway points you'd like to leave them with.
Absolutely. I think that the one thing that is really important is that you have to really educate over and over and over again. If you think that you the employees got the message through one open enrollment, they don't. They have to have repeated messaging to really absorb what it is that you're trying to communicate about your plans, about wellness, about healthcare consumerism. The other thing that I would say is that don't take for granted that an employee understands what a good healthcare consumer is. You really need to explain to them what they can be doing in a question and answer. What is it that they actually can do with those doctors to help them understand what their conditions are and how to help them manage those conditions. So I think that's really the important takeaways from, managing your medical spend comes from being accountable and responsible for managing it.
That's so well said, Margie, and it's really refreshing to hear from you, an employer, really on the front line, leading your workforce and committed passionately, to helping your workforce become better educated consumers of health and healthcare. And I really sincerely thank you for the time today. Thank you so much. I really enjoyed being on the show. Yeah, you have a great weekend, okay? Take care. You as well. Bye-bye.